Today we're diving into a hot topic. Is obesity a disease or a personal choice? According to the recent European Congress of Internal Medicine, obesity is a disease. The central message from the conference was loud and clear. Obesity is not a choice, it's a medical condition. But here's the thing, does it mean that people with obesity shouldn't take any responsibility? Or is it more like an addiction where blame just isn't helpful? Let's break it down and look at both sides of this debate. But first, welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends, and subscribe. So first, let's take a look at the conference view and its supporting arguments. So at this European Congress of Internal Medicine, experts were adamant. Obesity is a complex chronic disease. They pointed out that it's influenced by a combination of genetic, metabolic, and environmental factors. So it's not just about eating too much or being lazy. There are real biological drivers that make maintaining a healthy weight incredibly challenging for some people. And one of the key speakers, Dr. Jastrabov from Yale, discussed how the brain's reward pathways can be hijacked by highly palatable, calorie-dense foods, almost like an addiction. And this means that people aren't just making bad choices. They're struggling against powerful biological forces. And let's not forget the new wave of medications like Ozempic. These drugs are proving that obesity isn't just about willpower. If it were, why would medications targeting metabolism and hormone regulation work so well? Now, let's take a look at the counterpoint. Should we hold people accountable? Okay, so if obesity is a disease, does that mean that people are off the hook when it comes to taking responsibility for their health? Not necessarily. And here's where things get a little tricky. A lot of critics argue that labeling obesity solely as a disease can almost sound like an excuse, like saying, it's not my fault, I don't have to do anything about it. But that's not really the message here. Just like with other chronic conditions, and think diabetes or hypertension, taking responsibility is still crucial. You can't just rely on medications or surgery. Lifestyle changes like eating healthier and being more active are non-negotiable parts of this solution. And yes, people should be empowered to take control of their health. But we have to recognize that for many, it's not a lack of motivation or effort. It's a combination of biology, psychology, and environment that makes sustained weight loss incredibly difficult. Now, let's add another layer to this debate. Is obesity an addiction? I mean, think about it. Addictions are diseases too. If someone is addicted to alcohol or nicotine, we don't just tell them to snap out of it. We recognize that their brain chemistry has been altered. Food addiction works essentially in a similar way. Processed foods that are high in sugar and fat can literally hijack the brain's reward system, making it feel almost impossible to resist. So should we be approaching obesity more like we do other addictions, with a combination of medical treatment, behavioral therapy, and strong support systems? Some people argue that labeling obesity as an addiction could help reduce stigma because it shifts the focus from blame to understanding. But others worry that it might actually add to the stigma because society still tends to see addiction as a personal failure rather than a medical issue. So it's a tough one. So there is no one-size-fits-all answer for this, and it really depends on how we use these labels and how we approach treatment. So where do we go from here? Whether we see obesity as a disease, an addiction, or both, the key is to take a compassionate and evidence-based approach. It's about treating the underlying causes, if there are, such as hormonal imbalances, metabolic dysregulation, and the big one, emotional eating that applies to many people, not just blaming people for their weight. At the same time, it's crucial to empower individuals to make healthy choices and take responsibility for their well-being. So it's not about making excuses or ignoring personal accountability. It's about understanding that this is a multifaceted challenge. So let me know what you think in the comments. Should we treat obesity like an addiction? Should doctors do more and address it as a disease? Or is there another better way to approach it? I'd love to hear your thoughts. Thank you so much for watching. Until next time. Bye-bye.